All right, let's get real for a second. We've all been there, right? That feeling when nature calls. But for whatever reason, it's just crickets. Maybe you're traveling, maybe you're stressed, or maybe your diet just went completely off the rails for a few days. You start to wonder, how long can this even go on? So, let's push that thought to its absolute limit. What if you literally didn't poop for an entire week? It sounds kinda gross, maybe a bit of a silly thought, but deep down, haven't we all at least considered the mechanics of it? What would actually happen inside your body if you just held it in or simply couldn't go for 7 whole days? Okay, let's demystify this. Your digestive system is an incredibly efficient, albeit sometimes temperamental, assembly line. From the moment you take a bite, food journeys through your esophagus into your stomach where acids break it down, then into your small intestine where most nutrients are absorbed. What's left in digestible fiber, dead cells, bacteria, and some water moves into your large intestine, also known as your colon. Here, more water is reabsorbed, and the waste material is compacted into what we lovingly call stool or poop. This process usually takes anywhere from 24 to 72 hours. Your body's got a schedule, and it likes to stick to it. So, if you hit pause on this vital process for a week, you're essentially creating a massive backlog. Imagine a busy highway at rush hour, but instead of cars, it's compacted waste. The longer that material sits in your colon, the more water your body tries to pull out of it, making it drier, harder, and increasingly difficult to pass. You're not just feeling a little backed up, your intestines are literally filling up. This isn't just about discomfort, it's about your body's plumbing system grinding to a halt. You'd start to feel incredibly bloated, experience painful abdominal cramps, and you might even lose your appetite because there's simply no more room at the inn. Think of it like a trash can overflowing, but that trash can is inside you. Now, beyond just feeling miserable, this is where things can get genuinely concerning. The immediate danger is fecal impaction. This is when a large, hard, dry mass of stool gets so severely stuck in your rectum or colon that you simply can't pass it through normal bowel movements. It's not just constipation anymore. It's a medical emergency that often requires a doctor's intervention to manually remove the blockage or strong medications to break it down. Left untreated, it can lead to more serious complications like tears in the colon or even, in very rare extreme cases, a bowel perforation which is life-threatening. But wait, there's more. Because your body isn't eliminating waste, it's actually trying to reabsorb some of the toxins that should have been expelled. This can lead to a general feeling of malaise. You might feel unusually tired, nauseous, or even develop headaches. Your skin might look dull and your breath, well, some people report what's colloquially known as fecal breath. Yes, the gases and byproducts of that stagnant waste can actually make their way into your bloodstream and affect your breath. It's not pretty, and it's definitely not a good look. Imagine trying to explain that to your friends or co-workers. Your body is basically telling you in the most unpleasant way possible that it needs to get rid of its internal garbage. So, it's pretty clear that going a week without pooping isn't just uncomfortable. It's a fast track to some serious medical issues and some truly bizarre side effects. It really makes you appreciate the simple, often overlooked miracle of a regular bowel movement, doesn't it? Our bodies are amazing, complex machines, and sometimes the most basic functions are the most important.